Hi guys, it's Jamie DeRollo and I'm here to go over our stretching lab with you today. There are a couple of things that I want you to take into consideration first when we're talking about stretching. There are several different types of stretches, such as static, dynamic, and PNF, proprioception neuromuscular facilitation. I know, that's why we call it PNF, right? So static stretching is going to refer to any stretch that is performed without movement. So when an individual gets into a stretch position and then holds that stretch, usually for 20 to 30 seconds, static stretching is very safe and an effective way, and there is no threat of injury. With all stretching, the first thing any of my patients, if they come in and need to get stretched, the first thing I have them do is warm up. Okay, so it might be a light jog around the athletic treatment center. It could be getting on a bike or an elliptical, even an upper body ergometer, so one of those arm bikes. And then if, there is such a point where either we don't have any of those modalities available to us, we could even use a moist heat pack. Okay, so we would have them warm up before we stretch them. Static is what I'm going to be showing you today. I will show you a little bit of PNF. Dynamic is usually something that their coaches have them doing out as they're warming up with each of their individual teams. So dynamic stretching is a form of stretching that's beneficial in sports that utilizes momentum and from form. So that momentum from static active stretching strength in an effort to propel the muscle into an extended range of motion not to exceed one's static passive stretching ability. Okay, and then the PNF, proprioception neuromuscular facilitation, is a set of stretching techniques commonly used in clinical environments to enhance both active and passive range of motion, with the ultimate goal being to optimize motor performance and rehabilitation. So usually there's going to be a hold, release, hold, and we will go over that shortly. So in this video, we are going to go over 10 different lower extremity stretches, which are hamstring, and in that there's 3 different types of hold. We're going to do groin, glute, piriformis, which some people might also call figure 4 stretch, the IT band, hip flexors, rectus femoris, quad, butterfly, and victory stretch. And then we also have 10 stretches for the upper extremity. I will show you how to do a warm-up abduction, and then we're going to do cross body with trapping the scapula down, an overhead also while trapping the scapula down, internal rotation both in forward flexion and in the scapular plane, chicken wing, serratus, bicep, rhomboids, and on all 4. So let's get going. Okay guys, now we're going to go ahead and stretch lower extremity. So I'm going to have my son here. He's going to lay on the picnic table, obviously, but we're improvising. The athletic training table, similar to this height. We're going to have him lay supine, so go ahead and lay down. I'm short, so I particularly like having their legs hang over the edge of the table so I can actually use it as leverage. The first one we're going to go over is hamstring, and in parentheses, I'll talk about windshield wiper, where we're going in 3 different directions. Who remembers the 3 different muscles of the hamstring? Hopefully you're saying bicep femoris, semitendinosus, and semimembranosus. So with this, and again, we've already had him warm up. He's been riding his scooter and skateboard around. With this, I have his leg hanging down. You can use your leg as leverage. Put your hand down here on the distal portion of his lower leg, thigh. Straighten the knee out, and then just stretch. Okay. So a static stretch would be holding for 20 to 30 seconds. But now I'm going to add a little bit of PNF, and I'm just in this sagittal plank. So go ahead and push down against my hand. Push, relax. And now I'm going to go up a little bit. Push, relax. You're going to go up. So he's actually using his own muscle to elongate that muscle. Relax. I'm going to do a windshield wiper. So again, hands down here. And now he should feel it more on the medial aspect. I'm not going to wait the whole 20 to 30 seconds because I don't want to bore you guys. And then you can go on the other side. I usually put my hand on the lateral aspect of his leg and we'll reach across. Okay. If you were taller, you might not need this. Sometimes we would actually get up on the table with him, so go ahead and scoot down a little bit. Yep, just lay down. And raise this leg up, hold this down like that. So whatever works for you. Okay. We're going to scoot back down. Now we're going to go over groin and glute. So he's going to lay back down on the table, bring one knee up towards you, and you're going to hug that knee. Okay. I'm actually going to scoot him down. Scoot, 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 scoot. Okay. So be careful if they're wearing shoes or cleats. Whatever clothes you're going to be wearing, it's going to get dirty. So might as well put a towel here. We're camping, so we don't really care. Or glamping. Okay. I'm also going to hold this. So when he's doing this, he's getting it down here in the glute, and here he'll get it in the groin because I'm pushing that down. Is it real? Okay. Now we'll do the piriformis. So similar. Bring this thigh to you, and hold this thigh. Thigh, not your leg. Okay. So again, he should be feeling it in his piriforms, or this could also be called the figure 4. I usually will put this on my shoulder and lean into it. You don't want to use all your muscle. It's easier if you can use your body weight. And then if they're still not feeling it, we'll grab the knee that's over here and bring it out. Do you feel it deep in your booty? Yeah. Okay. And again, we need to do bilateral, but for just this video, I don't want to bore you guys. We're going to go ahead and do one side. Okay. All right. Now you're going to go ahead and lie on your side facing that way. Yep, on your side. Normally we wouldn't have this table here, but with this, I'm going to bring his heel, bring towards your butt, okay? And I'm holding the hip. We don't want them rolling forward or backward, okay? And actually on this, cup this leg right there on that corner. Yep. So because on the treatment tables, it's slippery, okay? And now I'm just pulling this back. So when I'm doing this, I'm getting a little bit of his hip flexor the more that I bring his leg more posterior, and then he's getting more of a rectus femoris when we're bringing bringing his heel or his calcaneus to his buttocks. Okay, so this is one way. Go ahead and you're still laying on your side, but come towards me. Okay, make sure you're standing here so you don't have to have your leg. Make sure you're standing here so they don't fall over the side of the bed. Never had that happen, knock on wood, but we don't want that to happen, okay? So with this, straighten your leg out. This is going to be the IT band. So right up here, and the IT band attaches down here, just distal to the knee on the Gerdy's tubercle. On this, it's similar to the O'Brien's test, which we'll learn when we get to the hip, but you're going to have to laterally abduct, bring it back, and then let him kind of hang down here, and actually scoot down more towards me. So even this. That way he's hanging off the table, and I can get a really good stretch on this IT band, specifically this TFL, tensor fascia lata. Okay, lie on your stomach. Okay, so for this one, we do have the rectus femoris, which is one of our quad muscles. Bring your heel towards your booty. This one, because on this side. Okay, so first we can just kind of bring this here and see how that feels. Sorry about that, guys. Or we can bring his thigh a little bit posterior and hold it like this. Yeah. He's really, really tight. But, we've been sheltering in place for several months. Okay, so just this right here is going to get the rectus femoris. When we lift this up, we're getting more rectus femoris and some of those hip flexors. Now, knees together. Bring your feet up. And this is called victory stretch. I particularly don't like this one. It feels weird in my hips. So when we're in a time crunch with stretching student athletes, this is usually one of the first ones that I kind of throw out the door. But knees together, and then just like relax, you're going to externally rotate, and then you should feel it kind of in the hips. If they have an MCL sprain, we don't want to do this because we don't want to aggravate that. Okay? Go ahead and sit up. Did you know the butterfly one?
Right here.
Mm-hmm. Okay, so butterfly stretch is a lot of times they can do a lot of it on their own, but you can also help bring these knees down if they could go down. He's super, super tight. If that's not comfortable, you can always go behind him, get in that same position. You can be up on the treatment table with him and just grab kind of thoracic to low back and help him kind of lean forward. Yeah, I'm not going to force him. Okay, so that's it. Let me double check for lower extremity. Let me make sure I got all of them. Hamstring, windshield, groin and glute, piriformis, IT band, hip flexor, rectus femoris, quad, butterfly, and victory stretch. So another one for the hip flexor, sit down so your butt's like right here, almost falling off. Bring one knee to your chest and lay back. Okay, so we can already, this is more the hip flexor on this side. We can tell he's already tight because this is starting to lift up. We can just kind of try and put a little bit more pressure down here. And this is very similar to the Thompson test. Okay, so we're good for lower extremity. Now we're going to do upper extremity. So I'm going to have your head right here with your legs down there on. There you go. Okay, so for this one, we do the warm-up abduction, ABD, where I'm going to kind of have like the cool hand or cool bro handshake or whatever you want to call it. Yes, he's laughing at me. Okay, so the thumb is going to be up, and so leave your head down. As I'm kind of pulling traction, I'm going to slowly externally rotate. Okay, and kind of shake it out. And again, I'm pulling distraction, and I'm rotating his arm. Yes. Okay. So now we do the scap trap. This is crossbody. When we're doing the scap trap, okay, I don't have to worry too much because he is a male. With females and chest, we want to make sure hand placement is spot on, okay? So I'm using more of the palm of my hand, and I'm putting it on that inferior border of the scapula to kind of trap it up against the table, and then I'm grabbing distal on the upper arm and pulling across, okay? When we do the scap trap across body, sometimes on the females we'll end up just skipping it because we'll get this stretch when we do the last stretch for all fours. So this is scap trap across body, scap trap overhead. Again, 20 to 30 seconds for each. Okay. Right. So now we have, I believe, external rotation, where when they're on the table, we can use the table as a stabilizer, where I'm just going to externally rotate him in this plane. Okay. When you have pitchers or any of your overhead athletes, tennis, volleyball, swim, you'll find that they have a lot more external rotation than internal rotation, which is fine, but usually when you gain more range of motion in one, you lose it in the other. So now we do internal rotation, same thing. See, he doesn't have as much, which is fine. Okay, holding it 20 to 30 seconds. And this is more in the frontal plane. If we want to go on the scapular plane, how I explain it to athletes is it's not directly in front of you, it's not directly out to the side, but in a V. Okay, so now I'll just kind of utilize my thigh and internally rotate. Okay, and we're holding that for 20 to 30 seconds. We also have the serratus. So one thing that I have him do, he's going to punching and internally rotating. So punching and internally rotating. So a lot of times if they have elbow issues, make sure you're grabbing on the upper arm. Go ahead and punch the ceiling. Okay, and I'm not super strong, but I can kind of get his whole upper torso off that table. Okay. We also have the chicken wing. So go ahead and put your hand underneath the small of your back right here. Just one, the side that you're stretching. You're going to stabilize the glenohumeral joint with your forearm, lift up that elbow, and this is actually stretching the subscapularis. This is one of the stretches that I have to do on a table for this. All the other ones you can do it sitting up or even standing. Okay, so kind of relax and do a second one. All right, so now you're going to go ahead and flip over on your stomach. So he's going to lie prone. And just for sake of purposes, I'm going to stretch this arm now, just because I don't want my back to you guys. But put this arm in the same place, where right here. So with this, I don't know if you can see with his hair, but with this, it's bringing up that medial border of the scapula. If it's not, you can get a bolster or a towel. I don't have a towel right now, but you could kind of put it under there, and that would help kind of enunciate that medial border. But we're grabbing the medial border with our little baby fingers and pulling. Okay, we're pulling laterally, and then on the inferior angle, we are pulling superiorly. Okay, get up on all fours, and again, we'll be stretching this side. Nope, all fours. So, nope, knee can be down. Is that uncomfortable for you? No. Okay. So give me this hand. Again, we got the cool bro handshake. So rip, grab. We're going to do 1, 2, 3, and then on 3 he's going to relax and let me kind of pull him. I will hold his shoulder with my hand to help prevent kind of twisting of the body. We don't want his back injured. We want to stretch the posterior calf. So pull 1, pull 2, 3, relax. Okay, and you just see how his whole body, let your whole body curl under. I don't want that. Okay, I want there. Okay, and this is the one where we do the scap trap cross body. We end up skipping on some people. And then the same thing right here. 1, 2, 3, relax. And on this one, I might have them go ahead and sit back, so your booty back, and he'll feel that stretch. Okay, and again, use your body weight. Let me double check, make sure I got all of those stretches. So, oh, I forgot the bicep. I don't know how I forgot the bicep. Again, lay on your back. And with the bicep, you're going to come over closer towards this edge of the table. Remember, our biceps on the anterior portion when we're sitting in or standing in anatomical position. So with this, I have his wrist extended. Scoot over more towards me. And then we're just pulling down. Okay. I don't want to put his wrist in a weird or vulnerable position because, especially if he's a pitcher, I don't want to stress that UCL. Okay. So that's all we have right now for stretching. I encourage you guys to go ahead and stretch with somebody inside your house, and I will give you an assignment where most likely it would be you taking a picture, somebody taking a picture of you doing 1 or 2 of the stretches. Reach out to me if you have any questions, and I will talk to you later.
And cut.
I don't know how to edit, buddy.
Oh, hi.
Don't say.
Yes. I think it's a blue belly.
Got a blue belly lizard.
On his tail as well.